Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Hi everybody, I'm Arnika Dwi Asti from Department Nursing, Sekolah Tinggi Ilmu Kesehatan Muhammadiyah Gombong. And here I want to present my research. It is about the role of rumination related to depression in hemodialysis patients. Last stage of chronic kidney disease that we called end-stage renal disease or ERSD is a very serious and long-standing health condition in which the kidney is malfunction. ERSD is a very critical and life-threatening condition in which patient kidney doesn't function properly, and the natural function might lower by 10 to 15%. ESRD requires artificial ways of emission in order to keep the patient alive, normally known as hemodialysis. The ESRD patient have to undertake the hemodialysis in order to live and survive. ESRD is a life-changing illness. When a person experiences ESRD, it extends to all aspects of their lives. ESRD is a long-term and incapacitating condition that not only disturbs one's physical and psychological well-being, but also affects the emotional and interpersonal relationship of the person. Hemodialysis as a treatment for ESRD patients tends to cause limitation and decrease the quality of life. Some of them even got mental disorder. Depression is one of the most and highly common complications. Research by Andrade and Cecil and 212 show 41.6% people with hemodialysis experience depressive symptoms. It mainly includes depressive mood, loss of interest, low concentration, disturbance of appetite and sleep, guilty feeling, low esteem, low self-esteem, and hopelessness, among others. Rumination, known as the main factor of depressive mood. Rumination is the repetitive thinking of one's negative moods, and it's related to many psychological problems. It has relationship with negative mood states, internalizing disorder, and interpersonal difficulties. Rumination, the widely used definition of rumination is that proposed by Nolan Hoxema, that emphasize behaviors and thoughts that focus on one's attention on one's depressive symptom and on the implication of these symptoms. The research methodology. It is a descriptive correlational study with the objective was to determine the relationship between rumination and depression among hemodialysis patients. The research conducted in Muhammadiyah Hospital of Gombong. 80 participants were recruited using total sampling, with criteria included age 12 or over, able and willing to provide consent, Receiving prevalent hemodialysis treatment. Patients with cognitive limitation were excluded. We used the back depression inventory tool, BDA2, to measure the depression level, and the ruminative scale questionnaire to measure the rumination level. Demographic and clinical data was collected via a self-report questionnaire. The data was analyzed by using the IBM Statistical Package for Social Sciences version 24.0. Person chi-square analysis used to determine the correlation between study variables, for example, depression and rumination, which p-value lower than 0.05 was considered significant. It is the result of the research. In Table 1, we can see the demographic information of the participants. Most of the participants were men, 65%, age 46 until 55, 31.3%, high school graduated, 33.8%, are married, 88.8%, and do hemodialysis treatment for 7 until 12 months, 37.5%. Next, Table 2 describes the rumination and depression score of the participants. From the table, we know that 67.5% of our participants show moderate score of rumination, and 32.5% have high score of rumination. 36.25% of our participants show mood disorder. It is BDI more than 11, and 15% show depression, BDI more than 16, in various degrees. 8.75% mild depression, 3.75% moderate depression, and 2.5% severe depression. In Table 3, we can see the correlation between rumination and depression on hemodialysis patient. The data analyzed with person chi-square and described that p-value is 0.0226, which is mean p-value lower than 0.05, means there was significant relation between rumination and depression on hemodialysis patient. Depression is common psychological on hemodialysis patient. A research by Silva et al. Investigate the occurrence of depression in 148 hemodialysis patients, showed depression in 101, 68.2%. It is also the same result with research by Ang, Jitan, Mopil, Nguyen, and Griefer that verify the course of the depression and anxiety syndrome during 12 months of 159 hemodialysis patients, so that 39.6% of participants presented persistent symptoms of depression, while 32.1% presented no or mild symptoms. Depression should be treated because it's related with quality of life or QOL and mortality on hemodialysis patients. research that verified the correlation between depression and quality of life in 166 hemodialysis patients showed that 7.8 patients with depression symptoms have lower scores on vitality, emotional aspect, and mental health. Santos 211. It also have 37% of suicidal ideas. Macaron 214. Rumination known as a mediator of depressive symptoms. Rumination or recursive self-focused thinking has important implications for understanding the development and maintenance of depressive episodes. Rumination is associated with the worsening of negative mood states, greater affective responding to negative materials, and increased access to negative memories. Neural activity during rumination was greater for depressed than for normal participants in the amygdala, rostral anterior cingulate or medial prefrontal cortex, dorsolateral prefrontal cortex, posterior cingulate, and parahippocampus. These findings indicate that rumination self-focus is associated with enhanced recruitment of limbic and medial and dorsolateral prefrontal region in depression. Coney 210. The study by Sinatra 211 with 103 hemodialysis patients and 101 healthy patients in southern Italy confirmed high levels of depression in CKD patients. 79.3% of HAD patients for less than 4 years and 64.4% for more than 4 years presented depression symptoms. Depression was influenced by perceived social support, alexithymia, and the cognitive elaboration of emotional troubles associated with the disease. Rumination was positively associated with depression normal controls. Rumination was but negatively related with depression in patient dialysis for 4 years more. Rumination appeared as a dysfunctional consequence of emotion for normal controls, but had an adaptive function for patient dialysis for more than 4 years. That's why the more patients do hemodialysis treatment, they will get adapted with the condition, so the rumination and depression scale will decrease. Okay, and the last one, the conclusion is, it is important for hospitals to make policy for therapy or treatment that can be given to reduce rumination in hemodialysis patients so the depression will decrease. It is the references, and thank you. I think that's all what I can say. Thanks for your attention. Wassalamualaikum warahmatullahi wabarakatuh. See ya.